Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. PBC, that is a pulmonary or the primary biliary cholangitis. So versus the PSC. PSC stands for the primary sclerosing cholangitis. So what is the PBC? The PBC, this stands for the autoimmune disorder. It is autoimmune disorder. So it is most common in case of females and it is about 40 to 60 years of age. It has an anti-mitochondrial antibody. So primary biliary cholangitis, anti-mitochondrial antibody. It is an antibody positive in most patients. So investigation of choice, it includes the biopsy, and the pathology, it includes the progressive destruction of the intrahepatic bile ducts. So progressive destruction, and this is of the intrahepatic bile ducts. Intrahepatic bile ducts, and diagnostic appearance, it includes the florid. So there is a florid duct. There is a florid duct lesion which is present, and this is with the lymphocytic infiltration. And also the granulomatous inflammation. So it is associated with something known as the CREST syndrome, the Sjogren's syndrome, and the rheumatoid arthritis as well as the celiac disease. Complication wise, the PBC, it includes the CREST syndrome, we saw the CREST syndrome, Sjogren's, rheumatoid arthritis, celiac. So this is associations. Now the complications is it includes the cirrhosis as well as there is presence of the bile duct inflammations can be seen. So bile duct inflammations as well as the periductal granulomas can be seen upon the microscopy. Next, moving on to the PSC. So what is this PSC? PSC stands for the primary sclerosing cholangitis. So this is most common in the males, and this is from the age group 30 to 45 years. So this includes the PANCA positive. It is PNCA positive. So investigation, it includes the MRCP. So investigation wise, the MRCP is a gold standard investigation, whereas in case of PBC, the primary biliary cholangitis, it was a biopsy. So here the investigation MRCP is the gold standard investigation, being the ERCP, and it includes the strictures. So strictures can be seen, and pathology wise, there is a destruction, and this is of both the intra and the extrahepatic. So destruction of both intra and extrahepatic ducts, bile ducts. It gives a pruned tree appearance. So there is a pruned tree appearance, and so destruction of both intra and extrahepatic bile ducts, and gives a pruned tree appearance and concentric onion ring. So onion ring fibrosis can also be seen. So the association of the PSC, it includes the primary sclerosing cholangitis. There is the ulcerative colitis, and the PSC is seen in 5 to 6 cases of the UC. So 5 to 6 cases of the UC, and the UC is seen in case of the 70 to 80%. So it is seen in 70 to 80% cases of the PSC. Now what are the complications of this PSC? Complication is it includes the cirrhosis as well as the cholangiosarcoma. Next, there is also the primary sclerosing cholangitis, the percutaneous cholangiography. On that, there is also the extensive bile duct strictures which may be seen. It may be seen as well as there can be dilations which can be associated with the PSC. To learn and grow daily like this, please do subscribe.